this rainy season has been a disaster, and our own president has declared this as it is a disaster for Zambia. So as community, what is the impact? First of all, the food basket will reduce at community level. Our CBVs, our NHCs, and indeed the people, what is our role? First of all, the CBVs, in their reporting, they need to identify children that are going to be affected by this drought, because the hospitals, the clinics, the health centers will be filled with malnourished children. The CBV need to identify the foods that are within their communities, that they can help the mothers, they can help the fathers, they can help the community to say, once we have this food, we can prepare it for our children, and our children will not be malnourished. It's not only the children, it's also the pregnant women. How do we ensure that the pregnant women are eating the food that they deserve to eat? Right now, all our maize, if not most of our maize, is stunted. It's not going to go anywhere. So what other foodstuffs do we have in the community? What other skills do we need to community CBVs so that they identify those children, bring them to the hospital, and start these nutrition classes? And I'm sure the Department of Nutrition is very well aware of that, and they started to work. But they will work with the people in the community. And who, for us, is the CBVs. And that's something. But we need, again, resources for this, because we didn't plan for it. As we are training the community now, we'll also need to add that component. And it's very, very important and critical. Again, what has come up is a lot of areas are going to have little water. Probably they do have the wells. Some of them have boreholes, but are they deep enough to bring in water, to the surface? So again, this is what the community CBVs should be able to identify. At this clinic, in this neighborhood, there's no water. Water is not coming out of the borehole, and bring it to the attention of the councillors, bring it to the attention of the community, bring it to the attention of the chief. This is going to be real. The rain was little, the groundwater will diminish, and we have to identify which areas don't have water and bring it to their attention. Because as you are saying, if we have all these shallow wells, they're also going to bring in disaster. We are going to have a lot of diarrheal diseases if that water is not clean. And this is now the job of the CBVs, to ensure that in every area they identify all these vices and bring them. Dirty water, dry wells, no water at all, where people are drinking water which is not, it can even be a river, but infected. And I think we have a big job to do, and as community should be ready for it. So we have to work as a team at the Ministry of Health and ensure, of course, we've been told for all programs, can we put up maybe a concept note, how we hope we shall deal with this